Okay, let's continue with our bones and get down here close to the lower limbs. Now what we see right here is the pelvis. The pelvis is sort of what you think of as your hips and everything contained inside of it. And if you look at what makes up both sides, left and right of this pelvis, you got what's called these big coxal bones. Here's one over here on one side, one over there on the other. And if you look up what makes up those coxal bones, it's actually a fusing of three other bones. If you come right here pretty much to the center of this deep depression right here that we'll look at in a second, pretty much everything from there up is a big bone called the ilium. And then right here to the front, you got this pubis and then ischium to the back. So they all sort of meet somewhat in that general area, but that's the three big bones on either side that make up the coxal bone. And looking up here at the top of the ilium, here's the iliac crest. That's this little ridge at the top, and this deep depression is the iliac fossa. Over here to the side, we can see some of these bumps, like there's an anterior superior iliac spine. Right below it's the anterior inferior iliac spine. Again, anterior tells you they're on the front. There's a superior on top and inferior on bottom, and there's spines on the ilium. It's a good name for them. So look at the sacrum right here. Of course, that's part of the vertebral column. We saw that in another video. And also right here, if you look at these little jagged lines on each side, there's your sacroiliac joint. Well, that's obviously where the sacrum and the ilium meet. We can also see these very deep depressions, what looks almost like two big old holes or whatever on either side, called the acetabulum. That's what the head of the femur fits into and where it articulates. Here we see the symphysis pubis. That's a piece of cartilage that binds the two coxal bones right here to the front, anterior. Obturator foramen are these very large holes you see left and right. The subpubic angle is that angle, that little region or distance you see in between these little points down here at the bottom. And those points at the bottom are called the ischiotuberosity. That's the lowest point of the pelvis. If you ever sit on a hard surface for too long, that's what starts to rub and maybe get a little bit sore. But let's also just mention a little bit of difference between the male and female pelvis. Now there's many things you can look at, probably about a half dozen or so, but a few of them stand out just a little bit more. When you look at a comparison of the shape of this little inlet, this little hole or space you see right here at the very top, on the male it's a little bit more heart-shaped and usually a little bit smaller, where on females it's usually a little bit more round or circular and a little bit broader. It's part of the birth canal. It makes sense it'd be a little bit broader on females. But then also look at this angle down here at the bottom. In males, that angle tends to be less than 90 degrees, where in females it tends to be greater than that. So now let's get to the femur, biggest, heaviest bone in your body. All right, so what's found in that thigh region from your hip to your knee. So right up here at the top, you see it's got a big head, easy to see, and there's a little point. So it looks almost like a little depression or a little notch right there in the center of it called the fovea capitis. Just below that, there's a neck. It's always a constriction below a head, nothing new about that. And there's a couple of large bumps up here at the top. And again, this is what's closest to your hip up here. This is the proximal part of the bone, and this is the distal part down here close to your knee. So again, back up here close to your hip, there's a couple of big bumps. That's the greater and lesser trochanter. There's a little bit of a ridge or a line in between them called the intertrochanteric line. Just below that's a little ridge right here called the pectineal line, and then a bump called the gluteal tuberosity, obviously where some muscles attach. This little ridge right down the back, and again, this is an anterior view over here on the left side and a posterior view over here on the right. So on the back, there's a little ridge going down the back of it. That's that linea aspera. And again, the body of any bone is just the main length part. That'd be the diaphysis of that long bone right there. And now we're down here close to the knee. We're down here just before you get to the knee, just a little bit more proximal to it. There's this adductor tubercle. And then you get to these epicondyles. Remember, these are going to be bumps. You reach down at your knee right there and feel those bumps on the outside of it. Well, there's going to be a medial and a lateral epicondyle. Right here in between them to the front is the patellar groove. That's where your kneecap articulates and slides right there. But if you look to the back, posterior part of this bone, there's a deep depression right there in the center called the intercondylar fossa. Again, the condyles are these little rounded articulations you see on either side, left and right. Well, an intercondylar fossa is a depression between those two condyles. And of course, we have our medial and lateral condyles right here at the very end. After that, we get down that leg or crural region. So here you're looking at that region from your knee down to your ankle. There are two bones down there in that region. There's the tibia and the fibula. Now the tibia is always the big bone that's medial to the inside, and the fibula is the smaller one that's lateral to the outside. So if we look at our fibula, not much to it. Now again, up here at the top of that picture, that's a proximal part of those bones up close to your knee. It's got a head, got a neck, and down here at the very bottom, there's a big bump called the lateral malleolus. And notice down here at the very bottom of this tibia, there's a medial malleolus. Well, if you feel down in your ankle at those two big bumps, that's what those bumps are, these malleoli. Those are the very ends of these two bones. Those aren't ankle bones, that's just the end of your fibula and your tibia. And again, since the tibia is the big bone on the inside, that's the medial malleolus on it. But coming back up here at the top of the picture, get this to be close to your knee, you can see there's an intercondylar eminence. There's actually two little points right at the very top center of this bone. Can't really see them in this picture, but they'll be there. That's that intercondylar eminence because it's something sticking up in between those condyles. You can see there's a lateral condyle to one side and a medial over here the other. There's a tibial tuberosity, a bump. If you feel that bump right there at sort of the top of what you think of as your knee, that's that big tibial tuberosity. That bump right there is where the big quadriceps femoris muscles insert. Just below that, there's the anterior crest. Now this ridge is what you think of as your shin. And again, there's that medial malleolus down there close to your ankle. Now look at your foot right here. Look at the different bones in this region. First, we got the tarsals. That's the 7 bones in what you think of as your ankle. Then you got the metatarsals. That's going to make up the length of your foot, just like the metacarpals make up the palm of your hand. And then, of course, you got digits and phalanges and such down here at the bottom. But going back to the tarsals, the calcaneus is what you think of as your heel bone. This talus is a big, large bone that the tibia rests right on top of. Just in front of that talus is somewhat of a little crescent-shaped bone called the navicular. And now if we start over here on the that'd be the outside of your foot. Here's your little toe, here's your big toe over here. So towards the very outside laterally, you got this big cuboid, and then moving inside to it, there are 3 cuneiform bones. So there's the lateral cuneiform, that's the one to the outside. There's a medial in the middle, in between it, and then there's an intermediate in the middle, and then your medial to the inside. So again, if you start over here at your big toe, there's medial right up proximal to it. Then you got your intermediate, then you got your lateral, and there's that cuboid to the outside there. And there's your metatarsals. And just like when you count the bones that make up the length of your hand, the metacarpals, you always start with, say, your thumb in your hand or your big toe on your foot. That's number 1 as far as the digits. And you count across 2, 3, 4, 5. Then again, you get down to your digits or phalanges right here, whatever you want to call them. They've got individual phalanx bones, just like you saw your fingers, nothing different. There's a proximal, a middle, and a distal, and your big toes missing the middle one, just like your thumb is.